Welcome to Aging Better in Uncertain Times. I'm Gord Martineau, in studio alongside Dr. Fabio Varlese. Here we help you keep informed and up to date on the latest in science, medicine, and technology that helps us all age better in these uncertain times.
I predict that the flu, if you're not vaccinated, and the many cold viruses will be considered COVID until proven otherwise. The strain that this will bring on to the healthcare system is significant.
And so as we grow older, our immune system gets weaker. So then, the likelihood of, the serious complications of infectious diseases is much higher. But also in COVID, we've got to remember that those with underlying conditions, and by that I mean diabetes, heart condition, lung conditions, they're also at greater risk.
When you look at Canadians in general, and especially adult Canadians, the vast majority of them think they're up to date with respect to their adult vaccines. But when you actually look into it, most of them aren't, over 95%.
Aging Better in Uncertain Times, brought to you by Jewel 88.5, L'Oreal, Avicana, and Sanofi Pasteur, in part through an educational grant. Thanks for joining us on our weekly guide into living better, healthier lives so that we can all experience aging better in these uncertain times. Throughout this series, we're going to examine the best ways to prepare ourselves for the future. What's the best advice for our overall health? We're going to look at every aspect affecting your life, and that means physical, mental, financial, nutritional, and medical. We'll cover all the bases. To do that, we'll supply you with high-value information from the leading experts in each field. And by that, I don't mean just everyday opinions. We'll be introducing you to the leading experts in each field, men and women who've studied, worked, and who teach at the highest levels. You have questions, we have the answers. Today we examine immunization, vaccines, and influenza, especially important in this age of coronavirus. Joining me now in studio is Dr. Fabio Varlese, a medical specialist in internal medicine and geriatric medicine. He's the Vice President of Medical Affairs and Chief of Staff at Runnymede Hospital, Staff Specialist at Baycrest Health Sciences. Dr. Varlese is also the Assistant Professor at the University of Toronto. Fabio, how important is it that people be focused? I guess, top of mind right now is COVID-19. So we need vaccines and we need, medicines that will help us ward off these problems. What is your say on the importance of these things?
Well, first of all, keeping healthy. And we do know that this virus, and the same is valid for any other virus or bacteria, keeping healthy is truly a focus. And the concept of wellness, as you pointed out, is a major issue. People need to look at what they're eating, how they're eating, the amounts of food and calories they're taking in, whether they're physically active or not. How are they living their day-to-day, especially during these tough times? Stress does play a major role in how well our immune system responds to these types of infections. And therefore, lifestyle habits do matter in maintaining the type of good health that then trickles down in your immune system.
So lifestyle is something that, that we don't pay a heck of a lot of attention to when we're young because, hey, we're going to live forever, right? Everyone thinks, I'll deal with that at some point later in my life. But as you approach, let's say, as you move into your 50s, you start thinking about, retirement's on the horizon somewhere. And then, as you hit 60, it becomes more and more of a reality. So lifestyle and health are extremely important as you move into your later years because they will have an effect on how you spend your life in those years, correct?
That is so true. I always advise, to develop those habits early on, but it's never too late. Mm-hmm. And therefore, it doesn't really matter, where you're at, what age. It is crucial to simply start looking at this seriously. And I counsel patients that are aging every day, and I always dedicate a little portion of my time to those lifestyle habits that will give them extra opportunity for health maintenance and protection.
We also have with us today a PhD and she is the Secretary General of the International Federation of Aging, Dr. Jane Barrett. Jane, welcome to the program today. We're delighted to have you with us. And let's talk about COVID-19 in particular. The World Health Organization, as early as April 2020, said that the lion's share, or 90% of the people who succumb to COVID-19 and die because of it, are 60 or older. Why is that especially a factor, the age?
Oh, well, it's good to be with you this morning. Thank you. Look, as we grow older, our immune system becomes weaker. That's a natural process. And I just want to pick up on a point of your previous speaker. We start aging at birth. It's not when we're 20 or 30 or 40 or 50. It's a whole process that we're undergoing. And so as we grow older, our immune system gets weaker. So then, the likelihood of, the serious complications of infectious diseases is much higher. But also in COVID, we've got to remember that those with underlying conditions, and by that I mean diabetes, heart condition, lung conditions, they're also at greater risk. So it's not only age, it's also other factors, Gord.
So it's a kind of a molecular situation, Fabio and Jane, that as you age, certain aspects of your health begin to decline. You become more susceptible to outside influences.
Well, there's no doubt. The opportunity for chronic disease starts showing up. And if the way we've been living has been inconsiderate of this, it will eventually develop into the chronic diseases that increase our chances of morbidity, meaning the opportunity to become sick and to land in the hospital, and mortality. And on top of everything else, as we retire, these numbers seem to spike up because there's an element of losing purpose. So the psychological indicators are also extremely important. We need to find purpose at any stage of our life.
Jane, would you say it's fair that, when we're in our younger years, we've got to pay attention to the people who keep saying, you've got to look ahead to your later years and really take care of your health?
Oh, look, of course, but nobody ever does. So it's actually got to be a moment by moment practice. And I like the idea that we can do this at any time. We can start right now. Stop with the sugar or stop with the Coca-Cola. We can change it right now. And I also agree with the comment about, purpose. A world-renowned Okinawan study in Japan, one of the critical elements for long life, purpose.
Well, Jane, that's a great insight. And as I mentioned, we have the leading experts in geriatric medicine and healthcare, et cetera, with us today. We have you, Jane. We have Fabio Varlesi. But we also have with us a distinguished individual, an adjunct professor, an associate professor in the School of Pharmacy at the University of Waterloo, and he was appointed at the Leslie Dan Faculty of Pharmacy at the University of Toronto. And John Papastergiou, you're with us today. Give us your insights, John. First of all, welcome, and give us your insights on the importance of vaccines, flu shots, and all of the things that we should be looking at as we move into our later years.
Yeah, it's great to be here, and a great question. It's a very timely question, actually, because it looks like a vaccine for this year's flu program will be available early next week. So we're about to launch the universal immunization program here in Ontario, and I urge everyone to get their flu shot, especially in a year like this where we have challenges around the COVID pandemic already. We want to try to prevent as much flu as possible. As you get older, I think the other guests have mentioned it, your immune system starts to wane a little bit. Its ability to fight infections naturally kind of starts to disappear. And what we want to do is give it a boost. And we do that with vaccines. When you look at Canadians in general, and especially adult Canadians, the vast majority of them think they're up to date with respect to their adult vaccines. But when you actually look into it, most of them aren't. The vast majority aren't. Over 95% aren't. So it's so important to have those discussions around vaccines with your physician, with your pharmacist. Community pharmacies now are offering almost all the vaccines They're convenient, they're accessible. There's no real reason why you shouldn't be getting your vaccines.
Fabio, I mean, how do you convince someone the wise, how smart it is to get the proper vaccines, no matter what your ailment is? Because as we age, we have more and more significant medical problems. So what do you say to people?
Well, this is a daily problem. I think that in medical practice, many clinicians struggle, trying to convince and counsel patients into receiving these much-needed vaccinations, especially as we age. And this year, more than ever, the vaccination for the flu is a must. I predict that the flu, if you're not vaccinated, and the many cold viruses will be considered COVID until proven otherwise. The strain that this will bring on to the healthcare system is significant. Therefore, we must more than ever understand that this is first and foremost for your own health. But then the volume of cases that could land the hospital for the flu, could be considered COVID until proven otherwise. There's going to be a strain on the hospital care system that can reflect back on our community. So this is serious.
Yeah. Jane, we've been hearing about a double dose or a higher dose, or what is the actual term here that affects older people, that they're being encouraged to take a stronger dose of flu vaccine?
Sure, it's called a high dose vaccine, and
okay.
I'm not the medical doctor here, but certainly some provinces have funded a high dose. And I think it's important, Gord, that we actually acknowledge that, there are different schedules in each province, and that makes it very confusing. And so it is important to have the conversation, but it's important for us to think vaccination across the life course rather than vaccines of babies, women, etc. So the high dose vaccine is very important because it gives the person, as John said, that boost to the immune system. Many people think that they don't need it because I'm healthy, I don't need that. But what it does is it protects us against this important infectious disease.
And John, you deal with people on the retail level. I mean, you're involved with Shoppers Drug Mart. You have several of your own locations in downtown Toronto. So you have conversations with people, elderly people probably, a large part of your clientele. How do you convince them that, A, the flu vaccine is a good thing to consider and you should get it? And then how do you tell them, look, you should get a higher dose?
Yeah,
because, they may be somewhat suspicious of vaccines. And, as you get older, you're somewhat mistrustful of everything you hear. What do you talk to them about?
Yeah, that's a great question. And there is very much this anti-vaccine movement. We see it more and hear it more in the U.S., but it's permeating into Canada. And it's something we have to address as, frontline healthcare providers. A couple of things here. First, the flu zone, the high-dose flu vaccine, will be available in community pharmacies this year. This is the first year that's going to happen. Historically, seniors would have to go to their physician's offices to get that vaccine.
John, when you say seniors, do you mean someone 60 or older, or at what point do you take the higher dose?
Yeah, 65 years of age or older is the indication here in Canada. And the idea here with the high-dose vaccine, it has 4 times the antigen that a normal dose vaccine would have. And the theory behind it is we know the seniors, it's more difficult for them to mount an immune response. So we're giving them a little bit of boost so their immune system recognizes that antigen and creates antibodies to it. Another aspect with the flu zone or the high-dose vaccine, it's weighted a little bit more heavily to a strain of the flu called H3N2, which is much, much more prevalent in the seniors population and causes a lot more morbidity and mortality. So this is kind of how I push the seniors towards the flu zone. The reality is many of them know about this. They know it's probably going to be in short supply this year with everything going on. Based on what we saw in the Southern Hemisphere, 30% more vaccine was administered and the demand was much, much higher. So another aspect of this, Gord, is we're also doing COVID testing in some sites for asymptomatic patients. So the traffic through these pharmacies is going to be enormous, and we're going to manage it the best we can. To the other part of the question about how do you convince them? I mean, it's not easy, and it means different things to different people. So you got to kind of find that one.
And you have to talk to people
resonates.
in very plain terms. You can't use a lot of, highfalutin verbiage, for want of a better expression. You got to talk to them, one-to-one, as it were, right?
Yeah. The number one thing I hear, I'm in the Greek town on the Danforth there, and I hear a lot of things, but I got the flu shot last year, and I've never been more sick. You hear that all the time. And people, confuse the flu with the common cold, with strep, with other things. And I always tell them, listen, if you had the flu, you would have been out for 2 weeks. If you didn't die, you're lucky you got the flu shot, So a lot of times you may still get the flu, but it attenuates how bad the symptoms are for you. And with respect to the high-dose vaccine, we see a 24% increase in the efficacy compared to the other quadrivalent vaccine.
So anytime you have the ability to use something stronger to ward off the flu, you should take advantage of it. Fabio, you brought up a good point earlier about if people don't get a flu shot, then, and they get the flu, they're going to put an extra strain on our already overburdened healthcare system, because they're going to end up in the hospital. And we need those spaces and those treatments for people who maybe come down with COVID-19.
That is correct. And that's why it's crucial for all Ontarians and Canadians to listen very carefully to this incredible and very important information. It's not just about them, it's about the community at large. It's not just about their families, it's how their behaviors will reflect on others and how that will trickle down in the emergency rooms and those much needed ICU beds for very serious cases, need to be protected. And so, yes, that's definitely a big issue.
Jane, seniors can actually lead by example, going to get their flu shots, even the high-dose version, and spread the word and talk to their families about it, because seniors obviously have children, grandchildren, and so on, and so they can spread the word, correct?
Yes, they can be the leaders of an intergenerational movement around influenza vaccine. Mm-hmm. And what we need to remember, Gord, is that, influenza, the complications are so serious that someone elderly may not return to their function, pre-infection. Yeah. So some people are more likely to have a heart attack. Some people are more likely to be so incapacitated that they will actually have to go into long-term care. So the serious complications of influenza, are such that we all have to line up. And could I just, a big call out to pharmacies, that is the simplest way for an older person to get their vaccination this year. And why not line up? Now's the time. So I would say grandparents around Canada, be the first there and take your grandchildren and children.
Good advice. And John, you have a COVID testing situation now at Shoppers, and we know that. We've heard about that. But that's people who are asymptomatic. How do you convince people to say to come in and get tested? I mean, if you're asymptomatic, obviously you don't have the symptoms. So how do you, get motivated to go in and have a COVID test?
Gord, I've never seen a demand for a service like this in my career. We were actually surprised by the volume. I'm one of the 62 pilot stores that's offering the service. So it is for asymptomatic patients that belong to a high priority group. So these are patients that are either traveling, are visiting people in long-term care, or living in long-term care, go to homeless shelters. So there's set criteria. So we're trying to make sure that symptomatic patients don't show up for first things first. We don't need them in a high-risk setting like a pharmacy, but there seems to be such a demand, even in these high-priority groups, that we're screening patients by telephone. We're setting up a set appointment time, and we're encouraging them to come, get their test, and leave. It's, we're under social distancing restrictions as well. We can't have over 55 people in the store. So imagine the traffic this is generating. Yeah. But the goal here is to pull some of the stress off the traditional assessment centers that were showing really, really long wait times. And I think we've done that. I'm approaching about 100 tests a day now. So it's definitely a service.
How quick do you get the results?
Yeah, that's the challenge right now. I think the labs are a little backlogged. It seems like the turnaround time's around 4 days.
Okay.
3 or 4 days. We were hoping for 48 hours, but right now that's not materializing.
Yeah. So, Fabio, there's a bit of a conundrum here. I mean, you have people who have symptoms, people who don't have symptoms. If you're asymptomatic, how do you know you're asymptomatic? I mean, this is one of the problems that how do you know you're not carrying or that you can't transmit or you can?
Well, usually a person who is asymptomatic may feel worried about getting tested because they may have been in a situation that could have put them at risk, whether going out in a social gathering. And many times, even despite following all the rules, they may develop a worry, a fear that they may have it. So it's, again, they don't have the symptoms, but they may have the fear of a possible exposure.
So will a test say, okay, you're asymptomatic, but you do have certain qualities where you could be transmitting this problem?
Well, it's very interesting to say this. As the same thing as for the flu. Like, the week or two before actually showing your symptoms of flu, you can still give the virus to another individual.
Yeah.
And so asymptomatic patients, and this is still being debated a lot among various academic groups, how contagious are you even as an asymptomatic person?
Yeah.
That is why it is crucial the moment an exposure did happen is that individual place themselves in quarantine, call Ontario Public Health, do all the things that protect others.
This is where we get into contact tracing.
Correct.
And that's how we get a stranglehold on this COVID-19.
That is correct.
Right. Jane, getting a flu shot and being tested for COVID are things that seniors have to know and have to deal with at some point because, obviously from the stats that we've seen and the number of fatalities we've seen associated with COVID-19, people over 60 are much more vulnerable to the effects of COVID-19.
Look, they are, Gord, but I think we've got really mixed messages in the community at the moment. Because if you look at the stats now, and it was just last week, 69% of those that were diagnosed were under the age of 40. So someone's doing something right and someone's not taking care. We go back to test, trace, isolate. And those three words are key. And we know the evidence is so strong. Wear that mask. Put it on.
Yes.
And please, can you just not put it on your head? Or can you put it on, so it covers your nose?
Yeah. You see people walking around with the mask, on their chin, or like you say, over their head or hanging from one ear. I mean, it's not offering any protection at that point. Yeah,
look, it's no protection at all. And it's not even a fashion statement anymore, Gord.
Yeah.
So, older people are showing the way. Let's all take responsibility. And that means, from the little ones all the way through, because that's how we fight and win against this COVID.
John, when do you think we're going to move into a situation where testing is, maybe not immediate, but takes 15, 20 minutes? Because there are tests out there that are being developed where you get the results, and it's a blood test, which is a turnoff for some people because you have to prick your finger. But still, the results are much more immediate. When are we going to get to that point, do you think?
Yeah, I think not too far away. I think I do a lot of my academic work is in the space of point-of-care diagnostic testing, and we're right now playing with a device by Abbott called the ID Now. So it gives us your COVID result in about 15 minutes, real-time reporting essentially, which is super important. So hopefully we're going to see these devices. They've just been Health Canada approved in some community pharmacies and other healthcare settings. So we're able to test patients quicker, get the results quicker, because it's important. If you're waiting right now 48 hours, you may be positive, may not know. And we've seen this situation in Ottawa. Guys, went bar hopping, and then by the time they get their positive test result, they've shut down 4 bars, right? The reality is, what is the value of a quick positive test? And in certain situations, it's quite valuable because we could get these people at home and isolated faster. So I don't think it's very far away. We've just gotten Health Canada approval. There's going to be a demand on these machines globally, I imagine, but hopefully Canada gets its fair share.
Dr. Varley, you graduated top of your class, University of Rome. You became a diplomat with the American Board of Internal Medicine in Cleveland, Ohio. You moved to Toronto, where you specialized in geriatric medicine at the University of Toronto. You spent your life studying geriatric illnesses. COVID-19, we are continually informed, or more and more lately, that the effects of it may be longer lasting, especially among seniors, correct?
Yes, we're getting to know more and more about this virus, and I never, in my personal career, have I seen new information coming along from different academic centers around the world where they're noticing new findings, new complications from this virus, and they affect all organs. To put it simply, they have a massive impact on our vascular system and on our blood, and there are elements of because the blood affects every single organ, it's clear that organs will be sometimes irreversibly affected. There's been issues on cognitive sequelae from this infection, lung obviously, but also liver and kidney. And so as this pandemic goes forward, new publications, new evidence will surface, and the medical community will continue to learn about this disease. But it is a remarkable virus, I have to say.
Right. Jane, you are the Secretary General of the International Federation of Aging. Now, this COVID-19 has set off alarm bells everywhere in every area of modern medicine. How are you dealing with it at the Federation?
Well, look, it's an important question, Gord. The IFA, whose headquarters is in Toronto, we inform the guidelines of WHO. So we're in formal working relationships with the World Health Organization and the United Nations. And so one of our jobs is to inform the guidelines and also work with patient organisations in every country of the world so that information gets to them so that they can then communicate it with patient groups and advocacy groups such as ourselves. So we're a channel, and also we bring experts together across sectors and disciplines. So when we talk about vaccination, we'll have diabetologists and cardiologists at the table because they're at-risk groups. So we work with the UN, WHO, and then at a country level.
There's a certain level of confusion, though, Jane. I mean, you keep hearing things about, well, the Centers for Disease Control, CDC, or WHO, the WHO, the World Health Organization, said this or they said that. And people are going, wait, what do we believe in here? Because, you've got political influences being brought to bear on health agencies. So
Sure.
What are you telling people?
Yeah, I believe the science. Go to the science. Don't believe the politicians. Don't believe any politician. Go to the science.
Good advice.
And so the WHO guidelines are evidence-based guidelines. They're built on science. And because, Gord, we've got to remember that vaccines, is the most effective public health intervention, second only to safe and clean water.
Right.
So we have to believe the scientists.
Fabio, you're a scientist. You've been a scientist all your life. I mean, in terms of geriatric medicine. So you probably get a little bit upset when you hear, contravening opinions, involving CDC and WHO.
Yeah, this is a tough situation because the community is listening to everybody. They're listening to the authorities. They're listening to politicians. It's very unfortunate that this topic is being politicized, in some countries more than others. I personally feel that our government is doing a pretty good job when we look at what's happening around the world. But this has to be that we need to follow our medical authorities. We need to be diligent in listening carefully. When you mentioned, even a test, when you go and get a test done and it's negative, that doesn't give you a sense of false reassurance of, I'm fine, therefore I could break any of the rules remain. Social distancing, wearing the mask, washing your hands. This does not change. You're lucky that you're negative, but you go back to the drawing board and living your life also without the fear, though, because you need to feel empowered.
Well, this is a thing. This is what COVID-19 has done to our society, is it injected a high level of fear. We think we have to, hunker down and sit in a room for the rest of our lives.
I mean, stress is one of the biggest negatives when it comes to the strength.
And it affects the immune system.
Absolutely. I was about to say that. And so the question is, rather than drowning in fear, simply be diligent that we're all going through this and one day this will be gone. The way to get through this in the best possible manner is to simply follow the rules, get good at it, and still live your lives within the recommendations that are coming your way, because life still goes on, and just feel proud about how well you're listening to the medical experts.
Good advice. John, Jane, and Dr. Fabio Varlesi, thank you so much for your input today. We've covered a lot of ground, and folks, I hope you got some great advice, and follow the advice of scientists. That's the best advice ever. And if you have any doubt, get online and go to myflushot.ca. So, Dr. Fabio Varlesi, we covered a lot of ground today. What are some of the more pertinent points that we covered?
Well, I think that I would say, number one, vaccines, we must vaccinate this year more than ever. It's a yearly necessity, but this year more than ever, vaccination for the flu will definitely have a significant impact, not only on the health of individuals, but also the strain on the healthcare system. And there should be no question about the importance about vaccination, and no doubts about do I vaccinate or not, because the medical community is very clear about that. The second set of recommendations, I think, is all about lifestyle, because we know that chronic disease and poorly managed chronic conditions predispose to getting sicker, and the severity of disease is certainly worse if your health is not in check. So really, truly focus on a healthy nutrition. Can't believe I'm saying the Canada Food Guide 2019 actually, for the very first time over many, many years, is a good recommendation. Basic physical activity. If you can't leave the home, get creative in the home. Dealing with the stress of the pandemic is the toughest thing. Learn how to meditate. Right. Learn how to create a safe space for yourself. Great opportunity for this, because there's a lot of home time going on. So get creative in managing your stress and becoming centered during these tough times. But last and not least is definitely pay attention almost on a daily basis of the medical authorities that are telling us what to do, and remind us about the usual social distancing, wearing the mask, and washing hands.
So protect yourself by getting the right information. Pay attention to the science.
Yeah, definitely.
Thank you, Doctor.
My pleasure.
Questions about Aging Better can be emailed to info@agingbetter.ca or by visiting our website at agingbetter.ca. Aging Better in Uncertain Times, brought to you by Jewel 88.5, L'Oreal, Avicana, and Sanofi Pasteur, in part through an educational grant. Be sure to drop in for your next doctor's visit on Jewel 88.5, Sundays at 8:30 a.m. or at jewel885.com. Until next time, I'm Gord Martineau with Dr. Fabio Varlesi, along with producers Dominic Schulo and David Sursta. Be well and stay safe.